Hello everyone. So today I'm talking about vaginal candidiasis or vaginal yeast, depending on whatever name you decide to call it. Now, vaginal candidiasis is what usually causes this whitish discharge. Some people say it's like milk, some people say it's like yogurt. Those discharges are caused by vaginal candidiasis. Now, I will tell you what it is not. Vaginal candidiasis is not sexually transmitted. So most women they are shy of saying that they have vaginal candidiasis, or they are shy of saying they have white discharge because they feel people think they are promiscuous or they are going to contact the infection from somewhere else. So you should know today it is not sexually transmitted, and it is also not a toilet infection. So you should put that at the back of our mind. Now, 3 out of 4 women who have vaginal candidiasis in their lifetime. So that means it is very common. If you see 4 women, 3 of them should have had it or are even having it at that point where you are seeing them. So it's not something that is new to only you and not something for you to be shy of. So if you have it, please reach out for treatment. For the symptoms of vaginal candidiasis, one, it causes itching. Now, most women, you see them trying to itch, and this itching actually causes embarrassment in public because you cannot be itching your private parts in public. And because of this itching, it causes cracks around the opening of vagina or the lips of the vagina, which cause a labia majora. So that crack that it causes, so when you are urinating, it irritates that crack. It can also cause painful urination. So it causes itching, painful urination, and because of that, it can also cause painful sexual intercourse. So if you know you're having white vaginal discharge, you're having itching, then you're having painful urination, or you're having pain during sex, it's likely that that you have vaginal candidiasis. Now you'll be wondering, how does this infection get into the vagina? Since I said it's not sexually transmitted, it is not a toilet infection. Now, the yeast that causes this infection actually stays in the vagina, but it is regulated. Certain amount of it are there, and then there is also bacteria in the vagina also regulated. So anything that can cause the yeast to multiply more than normal or causes the bacteria to reduce in number, then favoring the yeast to multiply causes vaginal candidiasis. So you see, it does not have to be transmitted from somebody to you. It is already in the vagina. Now I'm going to talk about certain things that you do that causes the proliferation of the yeast that causes vaginal candidiasis. So one of it is antibiotics. Now most people abuse antibiotics a lot. Some people, if they sneeze, they're going to take antibiotics. Now, when you take antibiotics, does not mean it's going to a particular spot where you have that infection. It goes around the whole system, like around the body. If you abuse antibiotics, it also goes into the vagina, killing the normal bacteria that are in the vagina and causing the yeast to multiply and cause infection. So no, so if you are not under prescription by your doctor, please do not abuse antibiotics when the normal pH of the vagina is disrupted. Now, most thing that can cause this is frequent washing of the vagina. Some people call it ouching. Use soap to wash the vagina for it to be extra clean. And some people even use some chemicals to put in the vagina for it to scent nice and then everything. But you must know vagina has its own scent. So you don't need to put extra things there to make it scent nice. So if you wash the vagina too much with some people use soap to clean the vagina, you disrupt the normal pH of the vagina, thereby even destroying the normal flora, like the normal bacteria supposed to be in the vagina, letting the fungi to proliferate, which can cause vaginal candidiasis. So please stop using chemical to wash your private parts. High level of estrogen. Now, when do we have high level of estrogen? That's why I say that it's common among pregnant women. High number of pregnant women come down with vaginal candidiasis because of the high level of estrogen that they have in their body. And then also women that have attained puberty and then have not entered into menopause. So that is from pubertal stage before menopause, they are at risk of contracting vaginal candidiasis because of the high level of estrogen in your system. Yeast is normally in the vagina. So it's not every time that you go and do high vaginal swab or do vaginal test. Some people put that like what you want to take sample, and you see yeast there, you say you want to go and treat. It's not every time. If it's not symptomatic, like if you don't have the discharge or it's not itching you, you should not treat because, as I said, it's already in the vagina. It only becomes a problem when it's proliferates beyond its normal length. How do you prevent vaginal candidiasis from happening? Now, one of it is do not abuse antibiotics. As I said earlier, antibiotics destroy the normal bacteria in the vagina and can lead to proliferation of the yeast. So do not abuse antibiotics. Secondly, if you want to clean your private part, do not use antiseptic wipes because those wipes now goes there to kill the bacteria and then makes the proliferation of the yeast to occur. So do not use antiseptic wipe. Now, if you want to clean your private part, you use clean warm water and you clean from front to back, not back to front, to avoid bringing infection from the anus into the vagina because they are very close. They should not wear tight dress. Now, those tight dress now tends to conserve heat and then makes prevent your vagina from receiving air. If you are at home, you can pull off your clothes most times to allow aeration of your private parts, or wear light underwear or gown that can help the aeration of your private parts. Thank you.